So today we're going to hear about the WE Clinic, formerly known as the Women's Health Center. Many of you know that the founding director, it's not up there? Okay, Brett, take charge. They want you to do something over there. I don't know what. Yeah. So anyways, the founding director of the Women's Health Center, Tina Welsh, is with us today. Let's give a round of applause for her. Yes. Tina started that clinic in 1981, and then she retired in 2008 and has never looked back. And we're so glad that Paulina and Jordan are now at the WE Clinic. So please give them a warm welcome. I'm really glad it's you guys. There you go.
Hello, everyone. Thank you so much for having us once again and for selecting us again to be the recipients of the Woven Basket. We're so appreciative of your support and your time this morning and learning more about the clinic. So I'm Paulina Briggs, I'm the executive director.
And I'm Jordan Wigfall, and I'm the operations director.
And so I'll start by telling you a little bit about the history of WE Health Clinic, although you have a primary source right here. So if I get anything wrong or if you want more information, I would go to these two. But WE Health Clinic, as Kathy said, was founded as Women's Health Center, and its roots go back to 1975 when the Midwest Health Center was established as the first nonprofit abortion clinic in Minnesota in the Twin Cities. At that time, 95% of abortions performed in Minnesota were performed in the Twin Cities, but 55% of the patients were from greater Minnesota. So the leaders of that clinic understood that there was a need for other abortion providers throughout the state, and so they came together and decided to found one here in Duluth, which would come to be known as Women's Health Center. So Tina was the founding executive director of that clinic. Once again, yeah, another round of applause. And then Dr. Jane Hodgson was the first medical director of the clinic. She is really a Minnesota hero. She was a huge champion of abortion rights even before Roe versus Wade. She was the first doctor to be convicted of performing an abortion in a hospital. She did that before Roe versus Wade in an effort to challenge the laws against abortion in Minnesota and in the United States. And so she has always been a great pioneer and hero and champion, and we were lucky enough to have her as our first medical director at WE Health Clinic. Midwest Health Center Duluth, at that time, as it was called, was established in 1981. We didn't have any physicians local to Duluth. That's pretty common with abortion clinics, is that doctors are not willing to provide in the same city in which they live due to safety and security reasons. So we had doctors traveling from up from the Twin Cities, flying in on an airplane, and then eventually the clinic became self-reliant, and instead of being called Midwest Health Center Duluth, it became Women's Health Center. And then during those early years, the clinic had to move around a lot in different locations throughout Duluth because of the anti-abortion efforts. So there were a lot of protesters outside of the clinic at that time. They even sometimes glued windows shut. There was kind of acid attack at that time, and the landlords from which we were renting was not willing to put up with that, understandably, but that forced us to move around a lot in those early days. And so eventually we all, well, I wasn't there, but at that time they realized and recognized the need for a permanent home for the clinic, and so a group of incredible women and leaders in Duluth came together and raised a bunch of money, and raised a bunch of money and purchased the building where we are now, which is on the corner of First Avenue East and First Street, thank you, and renovated it and made it secure permanent home for the clinic, as well as the other partner organizations who helped us buy the building, which includes the Program for Aid to Victims of Sexual Assault, as well as the YWCA Duluth. And so now the building serves us as our permanent home, and it also is a great kind of community space as well. Other nonprofits can rent at the building for a pretty affordable price, and we have community rooms available for rent as well. So that's a little bit about the initial founding history of the clinic, some legal history that the clinic has gone through. So, as an abortion provider, we have faced some legal challenges here in Minnesota and then throughout the United States. Doe versus Gomez was a 1995 case. The Minnesota legislature was trying to restrict access to abortion by passing a statute that prohibited the use of medical assistance, the lower income state insurance offered through the state, prohibited from paying for abortion. The case went to the Minnesota Supreme Court, and the Supreme Court ruled totally in our favor, and rule that our right to have and decide to have an abortion is protected by the Minnesota Constitution and should be covered by the state insurance programs. So that was a huge win for us. And then, a more recent legal case that has been in the news a lot is the 2022 Dobbs versus Jackson decision, which overturned Roe versus Wade and removed the federal right to abortion throughout the United States. So, that was a big challenge in the abortion care space, and so now the United States has been left as a patchwork of abortion access, with some states having bans, restrictions on how far along someone can be before having an abortion, all kinds of restrictions, limitations on funding and stuff like that. Luckily, here in Minnesota, we're a very protected state, and we have very supportive legislatures and elected officials. So for now, Minnesota is relatively safe as far as abortion access goes, but we are surrounded by states that either have banned abortion or restricted it since that overturning of Roe versus Wade. And so we do see a lot of interstate travel of patients coming to Minnesota for care. Other notable legal cases, Dover versus Minnesota was in 2022. This was a court case that ended up removing a lot of the restrictions that had been in place in Minnesota to abortion access, so it allowed for not only physicians, but also nurse practitioners and physician's assistants and midwives, so mid-level practitioners, to provide abortion. It removed the need for parental notification for minors accessing abortion care, and so, yeah, it just further made abortion accessible in Minnesota. And then the PRO Act was an act passed by the Minnesota Congress in 2023 that further enshrined the constitutional right to abortion in Minnesota. So it's an interesting time to be working in abortion right now, especially in Minnesota, as we see nationwide abortion. Yeah, you have a question?
We have to give credit to our little senator for the PRO Act.
Yes.
Just a minute, the online people can't hear that.
We have to give credit to our Duluth Senator Jen McEwen for the PRO Act. She was the primary sponsor of that. So.
Yes, totally. Yes, our elected officials in Minnesota, and especially, yes, in Duluth, are huge champions for abortion access, and Jen's amazing. So yeah, in 2019, going back a couple of years, we made the decision to change our name from Women's Health Center to We Health Clinic to better reflect the patients that we serve. The clinic has always served people of all genders. And so besides abortion, we also do STD testing, birth control, other services that Jordan will talk about, but it's not just women that come to our clinic, it's people of all genders.
Yeah. Yeah, and then in 2020.
Gotta get in front of the camera.
I am in front of the camera. They can
Oh,
see
they
me.
can see you.
Yes, they can see me. I'm like, I see it. So yeah, back in was about 2023 was when Paulina and myself took over, and we kind of had decided that our old executive director, Lori Casey, because she did so many things with her job that we just kind of felt like she did too much and we needed to split her job into two, just because we just didn't think it was sustainable for one person to do it all. So Paulina works more with, like big picture things, like figuring out different things with having to do with the building, legislative, grant writing, things like that, taking care of big picture things when it has to do with the building and with our clinic. And I do kind of like the day-to-day, taking care of, like financial, like different financial things with the building, if grants come in, accounts receivable, billing, things like that, dealing with patient stuff. Kind of like some of the boring things, but I enjoy. And then some of the service, so going back to just this last year in 2024, we have, so our services that we offer for abortion care, we go up to 17 weeks and 0 days for suction abortion. We go up to 12 weeks and 0 days for medication abortion, which we are hoping to be changing in the next couple months, with going up to 14 weeks for medication abortion. And then for telehealth medication abortion, we go up to 11 weeks. We do have a local doctor and local nurse practitioner at our clinic, and it's been really awesome having practitioners that are here in town for us. especially that our local doctor is also our medical director. So she's able to, make decisions rapidly for us if things need to change or legislation happens. So we get to make decisions quicker than like you do in a hospital, which is really nice. Some of the different services that we offer wellness exams and pap smears. We offer transgender care, LGBTQ plus health services, STI testing, including rapid HIV and rapid syphilis testing, vaginitis, UTI testing, and treatment. We also offer PrEP, contraceptives, including IUDs and implants, emergency contraceptive. And we are really fortunate at our clinic that we have a lot of free things that we are able to give away. Like no patient has to pay for EC ever that comes to our clinic. We constantly get a lot of it for free, or we get it at a discounted rate. So we are able to give it away to our patients for free, which is very nice compared to if you were to have to go to any of like the local stores.
So you have to tell us what EC is.
Yeah. Oh, emergency contraceptive. I apologize.
You're in the biz. You got the lingo.
I know. Yeah. So emergency contraceptive that you would have to pay for in like the stores, like the grocery stores, would be at least $50, and we are able to give it away to our patients for free. So it is really nice. We also offer ultrasounds, pregnancy testing, and options education, miscarriage management, follow-up support patients who have had abortions at other clinics and who choose to manage their abortions at home. We do miniature navigating. We also do telehealth services, and we have in the last year started offering advanced provision. So that would be if you came in for medication abortion, also too if you just came in anytime for any services, we can also offer you medication abortion for a later pregnancy. So if you're not pregnant right now, we can offer you education on how to take that medication at a later date, and then what you would need to do to make sure that you were taking it safely and things like that, making sure that you were at the gestational age that you need to be, and that we are available for follow-up when patients take it. So that's kind of some of the services that we offer. Some of our patient numbers for like last year, we offered 565 abortions last year, varying between suction, medication, and telehealth. For family planning patients, we seen 642. For gender-affirming patients that were brand new patients, we seen 22 of them. We did 756 STI tests last year. We gave out 737 emergency contraceptive dispensed. We gave out 97 LARCs, which would be like IUDs or implants for birth control. Unduplicated patients, we've seen 855 last year, and then for total patient visits, so that would be like different things that patients were seen for, we did 1,819. So we do see a lot of people and a lot of patients at our clinic, which is amazing. Some of the not great things that we have to deal with at our clinic are the anti-activists. So they've been pretty persistent anti-abortion presence that we've had outside of our clinic. The groups are about 3 to 15 people. We do have volunteer escort programs though that help, stand off the protesters and help our patients get into the clinic, without having to worry about the protesters as much. Anti-abortion groups have continued the same intimidating tactics at our clinic, such as putting their bodies between escorts and patients, trying to get into patient vehicles, following patients more than a block down the street on foot, lying to patients about what they can and can't do inside of our clinic. Example, viewing their tissue or ultrasounds or being able to leave whenever they want, taking pictures and videos of patients, aggressively targeting patients' companions, encouraging them to go into the clinic and get the patient, save that baby, that kind of thing. Targeting clinic escorts in their personal lives and harassing them at the clinic by referencing knowledge of their personal lives, especially if they are faithful leaders or recognized for social justice work. We still have a crisis pregnancy center that is like kitty corner from us. They're called the Women's Care Center. They tell patients lies about our clinic, such as saying that patients need to have an appointment with them before they can be seen at our clinic. They also will lie and say that you need to have an ultrasound before you are able to have an abortion, which is not always true. Giving patients false information, telling patients about their pregnancy telling patients that they don't have pregnancy options, like that they're too far along or things like that. They'll tell patients that they are further along than they actually are, and then they don't come to our clinic when they could have actually been seen with us. And there are 93 CPCs and pregnancy centers in Minnesota compared to 9 abortion clinics. So that's just some of the challenges that we deal with the anti-activists.
So We Health Clinic is a nonprofit, and as a nonprofit, we rely on various funding sources. As a clinic, we do receive income from patient fees, insurance, and stuff like that. However, there are still a lot of funding challenges, and especially helping our patients pay and afford for the services that they receive. Most private health insurance, and actually the Affordable Care Act, explicitly prohibits states from including abortion in any essential benefits package. So most private health insurance, even that offered through the marketplace, although recently that changed in Minnesota, but most private health insurance doesn't cover the cost of abortion. So even patients that are insured often face challenges in paying for their services.
Can you tell me what the cost of an abortion is?
It starts at, for telehealth, meaning someone doesn't have to come into the clinic, it's just a virtual visit for medication abortion, is $400. And then in-person starts at $750, and then if you're farther along in your pregnancy, you can go up from there. Yeah. Which, I mean, isn't that much compared to like, a hospital visit, but for a patient, it can be a huge barrier. And luckily in Minnesota, the 2 lower income insurance options offered through the state do cover abortion, which is great for those patients in that they don't have to pay anything. However, from the clinic side of things, the reimbursement that we actually receive from those state insurance programs are abysmal. We actually operate at a net loss for every one of those patients that we see, and almost 50% of our patients are lower income and do utilize those lower income insurance options. So that means nearly 50% of our patients we operate at a net loss because that's just what the state reimburses for that care. So for example, an abortion at the clinic costs $750. The reimbursement that we receive from it is about $240. Telehealth is even worse. We charge $400, we get about $60, which isn't even enough to cover the cost of the medications that we provide. So that is a pretty big challenge for us. That's the end. All right, well, besides that, we also rely on grants, we rely on individual donors, and I guess I do want to talk to you about with the new administration, some of the more recent challenges and threats that we might be facing in the next few years or so. It could be anything as obvious and direct as like a federal abortion ban. That's something that the administration is talking about, or reducing the gestational age limit for abortion federally could be one tactic that they use to attack abortion access in the United States. I kind of feel like those might be kind of hard to get everyone on board with. I think that they're going to do a lot more back channel ways of restricting abortion access. The federal grant funding that everyone is so concerned about. We are a recipient of a federal grant that makes up about 25% of our annual budget. So that is one way that the new administration can undermine the work of nonprofits in general, and then abortion clinics specifically. Also going after states whose Medicaid, like ours, does cover abortion. That is another thing that they're talking about, is defunding state Medicaids in states that cover abortion access. So that would be devastating not only to us, but to anyone who receives state insurance in Minnesota. There's also talk about kind of punitive audits happening on nonprofits that the new administration doesn't agree with. Nobody really knows. It's kind of whiplash. Every week there seems to be something new coming down the pipe. And we are just really committed to continuing our work and focusing on our patients and doing what we can as long as we can. And that's about all that we have for you today. Thank you again for supporting us and for listening to us. And if anyone has any questions for us.
Q&A. Okay, we're going to start here in the back and make our way forward. Thank you for your work.
Do you find that you're getting any patients from out of state, noting the surrounding states' legislative changes about women's healthcare? Thank you.
Yes. So since the Dobbs versus Jackson decision that overturned Roe versus Wade, Minnesota in general saw about a 25% increase in patients traveling from out of state. At our clinic, it was about 20% or so. That being said, though, We Health Clinic has always been the only abortion provider in northeastern Minnesota, northern Wisconsin, the UP of Michigan. So those patients, even before Roe versus Wade fell, abortion access has never been great in the United States anyways, right? And that decision only made it worse. But we've always been the only abortion provider for those, northern Midwest states. So we always have had patients traveling from pretty far away to see us. Since the Dobbs versus Jackson decision, we have seen about a 20% patient increase, although it mostly isn't out-of-state patients. It's mostly the clinics down in the Twin Cities are the ones that seem to be taking the most out-of-state patients coming from Iowa, South Dakota, North Dakota. And so what that means is that patients local to those Twin Cities clinics are facing long wait times. They could be weeks, months wait times, which with a time-sensitive procedure like abortion is unacceptable. So those local patients end up being forced to travel to us because we can usually see patients pretty quickly. So it's kind of this ripple effect that's affecting all the abortion providers throughout the state.
Are there pro-choice people in front of the clinic? Could you talk about that, if that exists, and how interactions happen, and who one might contact if one wanted to get involved with pro-choice activists?
Yeah, we call them clinic escorts. So those are our volunteers that we train on dealing with the anti-abortion protesters outside. So the anti-abortion protesters are usually there one day a week, which is the day that we provide abortions. And so we have volunteers also outside who are there to keep an eye on the protesters, help patients walk in and walk past the protesters and literally physically shield them, kind of meet them at their car and prepare them for what they're about to walk through, and then help them walk through that. And yeah, you can go to our website. We do trainings about, I think it's once every couple months for clinic escorts, so if you're interested in volunteering, you could become a clinic escort. And yeah, but as far as how they exactly interact with the anti-abortion escorts or anti-abortion protesters, we have a kind of non-interactive relationship with them, right? The purpose of the escorts isn't to argue with the anti-abortion protesters. It is to support the patients on their way into the clinic. And so we don't want to escalate things. We don't want to, make it worse for the patient than it has to be. So we train our escorts very specifically to not interact, not argue, and to instead focus on the patient and just get the patient into the building as quickly as possible. Yeah.
Will.
I think we had a follow-up question for
follow up over here. Okay. Louise, I took it too quick.
So the greatest need is for pro-choice volunteers to actually be with a patient going from vehicle to the building. I just had this image in my mind of someone pro-choice standing quietly with signs that express pro-choice things. Does that ever happen, or is that just low enough down on the need that you just don't really worry about that?
We moved away from that definitely, especially on abortion clinic days, because again, it's already chaotic out there, and we don't want to. It's not about us and how we feel about the anti-abortion protesters on that day. It's about getting the patient in and not making it more traumatizing than it needs to be. But that being said, we do have events sometimes elsewhere around the city where you can, show your support of us and everything. Sometimes the anti-abortion protesters have events outside of the clinic, and in years past, we used to kind of do a counter-protest to them. But honestly, we've kind of moved away from that again because we don't want to legitimize their efforts. And a lot of times it's 5 of them, and they show up on a Saturday and nobody's there. So it's why would we legitimize them and encourage them to make them feel like they're getting to us, because they aren't. And we have many more supporters than they do. And sometimes it would just get kind of chaotic if it was kind of a liability thing for us to have things like that at the clinic, especially in direct response to them. So rather than like counter protests, these days we might have just our own thing elsewhere. Because sometimes those interactions with the anti-abortion protesters are just like, we're not going to change their mind, they're not going to change our mind, it's unproductive, and it legitimizes their stance and makes them feel like they're making a difference when they aren't.
Thank you, that's very helpful.
Yeah.
And if you wanted a pro-choice sign, there are protests, as you know, in Duluth almost every day. So you can feel free to bring that sign. There's all these other protests, you know, for a variety of things. Hands off, don't do this, don't do that. If choice was your thing, I'm sure you could use that. Will Munger's having a thought, and Sally wants me to stop talking. Very good.
She wants me to stop talking.
Oh, okay.
I may have missed this, but did you comment on what percentage of your issues, clients are abortion-related issues with abortion, or as opposed to just other routine issues? And then why wouldn't, if I'm a woman, go to a regular clinic for non-abortion related activity or issues?
Yeah, so we had like 1,800 visits last year. And of those, about 560 were abortion patients. So that's how many we do a year. And yeah, I mean, reasons to come to our clinic versus, a normal clinic or hospital system is that we do have so many grants and programs for people that are uninsured, underinsured, people choosing not to use their insurance for safety or privacy reasons, especially when it comes to like STD testing. Not everyone's comfortable talking to their doctor, surprisingly, and unfortunately, about their sexual and reproductive health. So those are reasons. Also, I think that, some people just prefer the smaller local clinic setting. And we're also very LGBTQ plus focused and friendly and affirming and welcoming. So besides abortion, we also, do STD testing, as we said, pap smears, gender-affirming care, just general reproductive and sexual health care. So I think the combination of the affordability, the welcoming atmosphere, we answer the phone right away, which I think a lot of patients appreciate. And yeah, the small clinic part of it, I think, is another reason why. But also, yeah, abortion specifically, isn't offered at primary care settings most of the time, and the hospitals don't offer it except for, kind of rare cases that have to face like an ethical board and go through this decision-making process. So abortion care really isn't integrated into primary care settings or even OBGYN settings at hospitals in the United States, which is kind of an interesting thing in general. The hospitals, aren't willing to take on that political risk, I don't think, and that's the reason why historically they haven't. Yeah, like in Canada and Europe and stuff like that, abortion care is integrated into primary care, and it's not this whole separate other issue. And so, in an ideal world, we would work ourselves out of business and work towards that, because abortion care should be just easily accessible and available at any doctor. It's a very safe, straightforward medical
Sometimes
care.
takes, sometimes you're in the clinic for 30 minutes getting your abortion. It's not, like a prolonged thing. And also too, at our clinic, we're able to, get patients in within a week. Like you may call your primary care, doctor at Essentia Health and you can't get in for a month to just get, like a quick question answered. And, we can get you in within a week, possibly, within the next day. So like that is also too, and also too, like out-of-pocket prices for our clinic are extremely affordable. So that's also something that is, a benefit to a lot of our patients is, like we don't charge you. I mean, you could go to Essentia Health and if you're gonna get an IUD, you're gonna pay $1,500, if not more, just for that part of it. Whereas at our clinic, you're gonna pay a fraction of that. Because, we have so many grants and different, ways to get, birth control and things like that for patients. So, we just, in our opinion, we're better than going to the hospital. So, yeah.
Will has another question.
I was just wondering about Planned Parenthood. Do they offer some of the same services, or do you work together with them?
Yeah, so Planned Parenthood in Duluth does not offer abortion care, but they do offer similar services to us. We are actually very fortunate for the director of Planned Parenthood, because she used to be an employee of ours. So we do end up working pretty closely with Planned Parenthood in Duluth. And we are actually pretty fortunate as well with the hospitals too, that our local doctor does have some, still ties to the hospital. So it's, we are able to, like get patients seen there if they need to go and be seen at a hospital instead of with us because of certain things that we just don't offer. So yeah, we do end up working closely with Planned Parenthood here in Duluth. It just kind of depends with, like nationwide, we don't necessarily get to work a lot closely with those, but we do work with the one in Duluth very closely.
Other questions? Yes, Beth Tamminen, come your way.
I just want to say one quick thing too while we're talking about Planned Parenthood, which is Planned Parenthood is great, but Planned Parenthood, the one thing that I'll say about it is, it is this large national corporation, and when people think of abortion in the United States, they do think of Planned Parenthood, which is valid. They do a lot of the abortion care in the United States, but actually small independent clinics like ours that aren't affiliated with a larger, healthcare system like Planned Parenthood, actually provide the majority of abortions in the United States. It's not Planned Parenthood, it's local individual abortion clinic like ours. And independent abortion clinics also tend to go further in gestational age than Planned Parenthoods do. Independent clinics tend to offer both medication and suction abortion options, which having both options is important for patients that aren't able to have one or the other or have a preference, compared to many Planned Parenthoods. And independent abortion clinics also tend to stick around for longer when they are being challenged in states and in local legislation. Planned Parenthood, as a large national organization, I think is in some ways more legally risk averse. So yeah, independent abortion clinics do a lot of the abortion care and a lot of the advocacy for abortion care in the United States. It's just that we don't have the large marketing and PR and legal departments like Planned Parenthood does. So yeah.
Yeah, it's just me and Paulina.
Yeah, I was going to comment. I think Planned Parenthood does some of the political forward, like just in terms of the Medicaid issue. If people missed it on the news, they delivered 180,000 pink beads to Staubers' office because that's how many people in our congressional district are dependent on Medicaid. So it was, but they have kind of the capacity, I think, to be out there, and then sometimes they take them lightning because of that, I think. But I'm really interested to know that most of the abortions are really done in independent clinics. But my question, more particularly, I have a young relative who got a medication abortion in California, where it was from her primary care, or that's, there was a thing, she needed it early, but she did it in office, and both, and I, because you had to go in there twice. I'm just wondering, is it pretty well, do some people come into your clinic to do that, or do most people just take it home and then you follow up?
It's kind of a mix. So we offer telehealth medication abortion, so some people don't have to come in at all, and they just have a video chat with the doctor, and we mail them their medications. For various reasons, other people might come into the clinic because they might need an ultrasound just to verify the pregnancy is in the right spot and everything like that. And so some of those clients choose to take the first medication as a clinic, but it's not required at our clinic at all. The entire regimen, the first and second medications, can be taken at home on the patient's own schedule. And education is just a really big part of that. It's just educating the patient on what to expect, what's normal, and then what might be a sign of a problem and a reason to call us.
Not many problems. You don't see many problems, many follow-ups.
About the number, the baseline risk for follow-up care afterwards is about 5% of medication abortions end up needing some kind of follow-up care. It could be as minor as, something very minor all the way up to something more serious. But most of the time it's something minor that we just call in a prescription for, or they might need to take an extra dose of medication. But around 5% of patients end up needing some kind of follow-up care after a medication abortion. And yeah, I'll also speak to advanced provision, as Jordan mentioned, which is providing all the supplies and the medications for an abortion before somebody is even pregnant. That's pretty unique to our clinic. There's only a handful of clinics in the entire United States that are offering that. But we felt like it was really important to recognize that medication abortion is extremely safe, and that patients are able to take control and understand the instructions, and that where access is at the United States right now, with it being so threatened, the more of the abortion medications that are out in the community, the better, because people are able to handle this. The instructions are pretty clear, the regimen is pretty straightforward, and the chances of complication is so low that we felt it was important to empower our patients to be able to have those on hand and ready for when they need them, rather than having to jump through a bunch of hoops and delaying their care when they need it.
So thank you for bringing forward those contrasting data between the big Planned Parenthood and the micro independent services. Who's collecting that data and where is it published and so forth?
We are a part of a membership organization called the Abortion Care Network. So that is a network of all of the independent abortion providers in the United States. And so they do a lot of the data gathering and reports on abortion care in the United States and how much of it is coming from independent abortion providers versus Planned Parenthood, and just kind of celebrating and uplifting independent abortion providers. And they're a great organization because they recognize that independent abortion providers are doing the majority of the work, but have very few resources compared to larger health organizations. So they've been able to help us with that.
So where's that organization and how is it funded or structured?
They're actually based in Minnesota. They're based in the Twin Cities. Abortion Care Network. They are I don't know, but they do accept donations that they then like funnel the funds through grants to different independent abortion clinics. So they must be a 501c3. And then they're also a membership organization. Yeah.
And then you really are they collectively, we don't know about truly independent and under the radar activity that is not affiliated with that organization at all. Is that a reasonable thought?
That's true. Although I will say, I think the majority of independent abortion providers are a member of that network. Although there certainly are, a handful that aren't. But I think the majority of them are, because they're a really great organization. They've helped us out a lot with legal expertise, technical assistance, grant funding, and connecting us with other abortion providers. And that's really helpful too, because we're just kind of out here alone doing it on our own, but we're able to connect with other abortion providers throughout the United States and see what they're doing and learning from them too, and vice versa.
Before I come your way, I'm just gonna pass this around. We find that some folks amazingly don't go to our service. They just come to this part. So we're gonna pass around this woven basket, and if anybody would like to make a donation that will go to the Week Clinic, that would be great. And so, Tina, you could start.
Tina's given enough.
Decades.
There you go, Tina's putting a little money in there. Carol Michelson not like it's a competition, but Carol Michelson did put some money in there. Okay, another question from the back.
Could you speak a little bit more about your transgender care? I know there are many, many facets to transgender care, and some of it's quite complex. And I know the medical care for transgender care in the Northland is pretty sparse or maybe non-existent. How do you do that through your clinic? Do you refer down to the cities, or how does it go? Thanks.
Yeah, so we started offering gender-affirming care in 2019. And so what that looks like at our clinic is that we do offer hormone gender-affirming care for adults over the age of 18. We don't offer it to minors at this time. And yeah, that was a really great change for our clinic. Because prior to that, most of our patients, they might come in once for an STD test or once for an abortion clinic, and then we might never see them again. But for gender-affirming care, it's this long-term relationship that we have over years and years. And we're able to be with people during their, gender-affirming journey, and to be able to be with them throughout the years has been really great for our clinic, and we've learned a lot. But yeah, so gender-affirming hormone care is what it looks like, and we do the labs at our clinic. We do it for prescriptions. That's great. And yeah, as far as like the rest of Duluth goes, it is kind of spotty. Although there are providers at both St. Luke's and Essentia that do it. And also, I don't know, I think Lake Superior Community Health might do it as well.
Mm-hmm. Yeah, they started doing it.
Oh, and Duluth Family Medicine does too. So there's providers here and there. And yeah, I mean, we're all connected with each other. We all talk, and we're all learning from each other too. We learned a lot from Family Tree Clinic down in the Twin Cities, who's kind of like the leader in Minnesota when it comes to gender-affirming care. So we learned a lot from their protocols and procedures and stuff. But yeah, our gender-affirming care program, like Jordan said, has been growing a lot. Last year we saw 22 new patients. However, our overall gender-affirming care patient count right now is, I think, at like 80 or
Yeah, we're probably almost at 100 gender affirming patients that we have from like the beginning of when we started doing it to now. We probably have almost 100 patients that have been repeated, that have either moved away and come back, or like they'll still be seen with us even though they don't live here and things like that. So yeah, we have a vast population of gender affirming patients that are definitely growing. Yeah.
And it's definitely needed. Like we hear from our patients too that like wait times at other places can be quite long.